Hi, my name is Dr. Josephine Connolly-Skonen, and I'm the director of the Dietetic Internship Program and Graduate Nutrition Program here at Stony Brook Medicine. And I'm going to explain a bit about our internship and our master's program. The picture here is our Stony Brook Heights rooftop farm, which is a really beautiful symbol of our food first philosophy for healing and disease prevention. This is a org chart for the nutrition division. So we are a very large division housed in the School of Medicine as well as University Hospital. We have a dual reporting structure, and we have a variety of different programs. We have an inpatient team. We have a 620-bed hospital. We have a woman, infant, child supplemental food program. We have a public health program in which we have our Stony Brook Heights rooftop farm. We have a food pantry. We also work with the Suffolk County Food Policy Council, so very robust public health group. We have our academic programs, our master's in nutrition, and we have our dietetic internship program, both on-site and distance. I will say now that we are in the process of getting state approval for our graduate program with the integrated coursework and rotation. So keep in touch with us about that. It is already accredited. We're just waiting for the final okay from the State Department of Ed. So for our dietetic internship program, you can choose to do that alone if you already have a master's, or you can apply to the internship and also apply for our master's and enroll in both of them dually. You can also consider whether you want to do an on-site program or a distance program. The on-site track, one of the advantages is that we find all your rotation sites and your preceptors for you. So you have a schedule laid out. You come here to Stony Brook, and the rotations are within the Suffolk County primarily. Heavy focus on clinical nutrition rotations, inpatient, outpatient, and long-term care. We also have research rotation I'll talk about in a minute, a virtual renal rotation, which is the same as we do for that distance track, public health rotation that you do with our faculty here with the programs that I was just mentioning, including our WIC program. And then food service is at an institutional food service setting for 4 weeks and a school food service for 3 weeks, since that's a nice place of employment for many RDs on Long Island. There's an elective rotation and a review week, which is a very robust review week. Again, we find your rotations for you. The distance track, the beauty of that is some people are where they want to be. They don't want to relocate. They might have family commitments. You might have a nice network in your community, and that's where you want to grow your network and eventually work as an RD. So people like to stay where they are sometimes, and we can accommodate that. Again, heavy focus on nutrition therapy for the hours of the rotations that you would do. We also, of course, have our food service that would just be in the institutional food service setting. A community nutrition might be at a food bank or a local Department of Health or a Suffolk County, not a Suffolk County, but a food policy council. They're getting more and more common across the country. You would do an elective similar to the on-site folks that you get to pick. The virtual renal rotation is virtual modules, and we do a field trip. And for the distance folks, you can Zoom in. And then the research rotations, I run both here if you're here or the distance track. If the distance track is your option, then it's a very robust CQI project that we access the Stony Brook EMR to complete. And then for the on-site track, it might also be a CQI project, or some years we are in the midst of a research project and you would get involved in that. This year we're doing a feeding study looking at pea protein versus egg white protein and the impact on the gut microbiome. Okay, for the distance track, we have been doing a hybrid orientation and review week. So you do need to come here for 2 days. We do plan on continuing that, but that might change over time. We'll see. But right now you should plan on coming here at least 2 nights, 3 days for the orientation and also for review week. Review week, we do they're called OSCEs, Objective Structured Clinical Exams. So we have patients that are actors, really, who play different parts. And we have a clinical skills training center, which simulates a hospital setting. And we have you demonstrate all the competencies that you've learned in your time with us. And then we also start practicing for the registration exam. We do career seminar, mock interviews, a lot to get you ready to start that first job. So Applicants have to have successfully completed a graduate program, because now if you're applying to the internship, or you can dually enroll in both, because again, as of 2024, January 2024, you need to have a master's program to sit for the registration exam. So if you already have a master's, then you just do our internship. Otherwise, you can do both with us. The master's is completely online. So if you're a distance track intern, that's not a problem. The master's is completely online. If you choose to do a master's first before applying to an internship, you can do our master's alone and then apply to whatever internship you would like to apply to. So lots of flexibility. If you want to spread out the coursework a little bit, then sometimes starting the master's before the DI is a reasonable thing. There are 9 credits of overlap with the DI experience if you are doing both your master's and your internship with us and dually enrolling. So that does save you both time and money. You can challenge out of 2 courses and you simply pay a challenge fee, not the full tuition. And for one other course, you can use one of the rotation modules to fulfill that practicum course, 580. And in that case, you do register for the classes, but you don't have to do any extra work for that class. So basically there's overlap for 9 credits or 3 classes. So that saves you some time and money, which is always nice. For our master's, we have an advanced nutrition therapy and critical care concentration. You can see the courses here. All of this, of course, is online, but the 2 courses that are specific to this concentration is critical care and nutrition support, as well as advanced pediatric and neonatal support. We have a really interesting integrative nutrition therapy concentration. And I say that because I'm biased because I teach one of those courses. So I teach the theory course, evidence-based concepts in integrative nutrition. And then there is a case-based course that follows. And lastly, if you're not sure what you want to concentrate in, or you want to kind of have a little bit more of a flexibility, and maybe you don't want to do critical care or integrative nutrition, then there's a generalist option that you could take as well. Okay, internship requirements. So again, this is all online. We do have a preferred GPA of 3.2. And I will tell you, we do take a very holistic look at the application. We realize that some people are putting themselves through school, so you may not have a lot of shadowing experiences or extracurriculars on campus, but you may work and you have a very robust and interesting work experience. So we look at all those factors, basically what you've done inside the classroom as well as outside the classroom. We picked the top 40 to 50 applicants for telephone interviews with 3 different faculty members. And then based on that, we score and rank. You do have to complete all of your didactic coursework and an undergraduate degree before starting the internship program, and that degree must be conferred. You don't have to take the GREs. We do not think that they're very meaningful. For the distance track, there are some supplemental forms you need to complete, and you do need to travel to Stony Brook for that orientation and review week, or at least a few days of each of those. And for the on-site track, you will have rotations throughout Suffolk County, so you do have to have a car, as we do not have public transportation out here in Suffolk County, New York. Okay, here for the distance track is the proposed rotation schedule form that you need to complete. So if you're on site, we do the rotation sequence for you and identify that. For the distance site, you're going to find sites in your community and preceptors, and we need you to complete this form. We do have contacts across the country. We can help you, and we will also take responsibility for getting the contracts executed. So that's something that we do. We consider our responsibility. And the preceptor form, we need to know who's going to precept you and their qualifications. Okay, here are some fun pictures. We do have an indirect calorimeter here at Stony Brook, which is considered best practice for nutrition support. A little bit more about our farm. Interns on site get heavily involved in the farm. Distance interns can get a little involved when you're here for orientation and review week. It is just something that we love to do, and we are now going to start including our produce in a food pantry we're starting. I mentioned we do some research projects here at Stony Brook. This is a feeding study, and our metabolic kitchen, we're preparing meals for our subjects. Interns do a chopped contest during review week, which is a lot of fun. I'm always very impressed with what the interns come up with. For our distance DIs, we have, that's a reminder that I need to finish up because I'm supposed to keep this to 10 minutes, so I'm going to wrap up. For our distance track, we do the research rotation via Zoom, and we stay in touch that way. For the distance track, we also have biweekly calls with you with a internship coordinator. So we stay very close in touch with you. We see how your rotations are going. If you feel that you're not meeting a competency or having some challenges, it's our job. You're a Stony Brook intern. It's our job to teach you. And we call upon one of the 35, 36 RDs we have here at Stony Brook if it's a particular area of specialty. So we are here to help you to get through and to meet all of your competencies. This is also on our website, but basically I consider our highlights to be the fact that we are in a large nutrition division, so lots of experience and expertise. We do a lot of the teaching and precepting ourselves. Stony Brook is very highly ranked. We're the #1 SUNY school. That was just announced in terms of rankings. When you're a Stony Brook intern, you have access to our online library system, as well as all of our e-journals, databases, and software applications. So it's a very fast-paced, dynamic environment. We hope you'll consider us, apply, and interview, and all of our contact information is online. Please give us a call and come to one of our open houses. Take care.